I'm here today with,
Rathia Lewis.
and my name is Kelsey Haynes. It is currently 1:18 on the 25th of September 2018, and I'm here to do a brief interview about abstinence and comprehensive sex education programs in public schools. And I just basically want to start off with a brief description of Dr.
Rathia Lewis.
If you don't mind, can you please have a brief description?
Okay. My name is Rathia Lewis. I am a nurse practitioner here at the Office of Public Health. I've been a nurse practitioner now for 13 years. The majority of my career has been in women's health, but I am a family nurse practitioner. Here at the Office of Public Health, we see young ladies and men for contraception, for STDs, for immunizations, as well as just pregnancy tests. We also have a TB clinic, a refugee clinic, but primarily my job is with the reproductive health program.
Okay. Well, let's just get the interview started, if you don't mind.
Okay.
My first question to you will be, do you feel if comprehensive sex education was taught in school, the STD and teen pregnancy rate would decrease? Why or why not?
I do believe that it would. I do feel that with the clientele that we see here, or just in my career, with the clientele that I've seen, the majority of the patients are young teens and young adults, and you find that they don't have the basic knowledge of what is out there. And I really feel like if they are knowledgeable about what they are subjecting themselves to by deciding to become active, I think they would be more prone to waiting to have sex when you know what you are kind of getting into.
Okay. Well, my next question to you would be, why do you feel abstinence sex education is taught in school?
Why isn't it?
Why is it? Because in East Baton Rouge Parish, abstinence sex education is taught in school, meaning that you shouldn't have it until an appropriate age.
Well, I think with the generation that we are dealing with now, when you tell someone that they can't do something, I think it kind of makes them want to go out to do it or to experiment more because of that. So I think if you educate them as far as the consequences of their actions with possibly becoming pregnant, becoming a teen pregnant person, or ending up with HIV or one of the other STDs that Baton Rouge is kind of high on the list in, they would be better equipped to make informed decisions for themselves.
Most definitely, most definitely. Well, my next question would be, if sex education, comprehensive sex education was taught in school, what would be a topic that will need to be discussed the most, and how come?
Well, again, I think right now Baton Rouge is number 2 in HIV. We're number 1 in syphilis, gonorrhea, and chlamydia. So I think the biggest thing that needs to be taught would be STDs, because what I think young people fail to realize is even though there are antibiotics that will cure most STDs that are bacterial, you still have those STDs that you are exposed to that are viruses that you can't get rid of. And of course, with HIV being the virus that you can possibly die from, I think it's important that young people are aware again of what is out there and know how to protect themselves from those things.
Okay. My next question is, you start seeing teenagers as the age of 13, correct?
That is correct.
If you don't mind, can you tell me, what do you see in the younger teenagers the most?
Well, the majority of the teens that are brought in, most come with a family member. Some come with friends, but the majority of them are coming in to get on birth control. Some are brought here and they're unaware of what they're coming for. They're unaware of what we do here. But most are being brought in or coming in independently because they're wanting to get on birth control to protect themselves from pregnancy. So I think that is more important to young people versus the STDs.
Okay, all right. What would be an age group or grade would be best to target for sex education, and why?
Well, I really think there's really no age limit because young girls are now experiencing their cycles at an earlier age. I mean, you have females that are getting cycles now at 8 and 9. So when you're able to have a cycle, then you're able to reproduce, whether it be well, at that age, they're not trying to get pregnant, but you do have people who get taken advantage of, and that can be something that happens because of that. So I think that I'm sorry. What was the question?
What would be an age group or grade to target best for sex education?
Sorry, okay, so yes. I think probably in elementary school, you really need to start the conversation. And then after that, so probably 5th grade, and then after that, it just needs to be a conversation that parents or grandparents or great-grandparents are having with their family members to properly educate them. But we do know that the education is not happening in the homes, and so it's left to the healthcare providers to kind of give the information. So I would say as early as 8 or 9, but definitely in middle school, it needs to start there.
Well, since you said that, my next question will be, do you think parents are responsible for the sex education? Do you think it should just be taught in school or at home?
I think it should be taught in both places, because sometimes the parents might not have the correct information. It might be from what they were taught. So if you're really not in the healthcare field, you might not have the correct information. So, but I do think if they take their family member to a doctor's office or a clinic or what have you, to get the basic information, it is their responsibility to kind of reinforce or to make sure that the conversation continues to take place, to make sure that they have the basic knowledge and that the kids feel free and comfortable to kind of be able to go to a family member to talk about things that we aren't always available to do.
Most definitely. Well, at the beginning of the conversation, I heard you say something about your children. And I know they will grow of age of having a cycle, or if you have a female. And my question to you would be, would you choose abstinence sex or comprehensive sex education for them? Why or why not?
For my own children, well, I have 2 daughters, but they're young. I only have a 4 and a 6-year-old. But I think comprehensive sex education is the way to go, because I mean, if you can't make informed decisions if you don't have all of the information exposed to you or available to you. Of course, we have things now such as smartphones, and so the information is available to you. You just have to kind of know where to go to get it, because everything that you see or hear about on computers or of course from friends and family members won't be the correct information. So I think comprehensive is pretty much your best bet to make sure that a person is informed the right way.
Okay. Do you think comprehensive sex would cause an impact on the economically? With the government issues, do you think it will cause an impact economically? Why?
Well, of course, if you are having comprehensive sex education available to people, and they are informed. They can make better choices for themselves. And so, of course, because of the numbers being so high in STDs, excuse me, in Baton Rouge, excuse me, it'll definitely make an impact, because you have so many people having to go into urgent cares or ERs or private doctors to be treated, and so sometimes patients aren't insured, and so the government is paying the bulk of that that cost, especially at these free clinics, or sometimes here we see patients that aren't insured, and so or even if they have Medicaid, that's still government money that's having to foot the bill on that.
Okay. How often should sex education be taught? Should it be a full-length class, once a month, yearly?
I think it should be a class that's available every year. I think parents should be able to, I guess, opt in or opt out of being able to take the class, or in the middle school and high school years, it should be an elective that is available. Because I think if it's something that's available to kids, maybe not in the middle school age group, you know, parents might not opt for their child to take the class, but in high school, if it's available, it's something that I'm sure most kids would want to take to get their information.
Well, my last question to you would be, if there's anything you wouldn't want to be taught in sex education, what would it be and why?
I really don't think there's any information that shouldn't be taught. Like I said, I think the more you have, the better knowledgeable you'll be. You know, it's your body, and I think you need to be able to understand what can and can't happen, what you are exposing yourself to. So I think there should be nothing that's off limits as far as sex education goes. There's a slogan that says, you know, the more you know. I'm not sure what TV station or what, you know, what that used to be on, but I really do feel like the more a person knows, the better equipped they are to make informed decisions that can impact their bodies and impact their lives.
Most definitely. Well, thank you so much. It is currently 1:31, September 25th, 2018, and I am finishing up this interview with Dr.
Ratheia Lewis.
Thank you.
Thank you.